Hi everyone, welcome to our presentation on a model for collaborative care. This was a model developed by myself and my colleagues at a liver clinic as a way to increase testing and treatment of hepatitis C for people experiencing homelessness and living in shelters. This was all developed during the COVID-19 pandemic as a means to continue providing Hep C care despite everything that has been going on in the last 8 months. So a little bit about us. Kate is a registered nurse working with CUP's Liver Clinic. Gisela is an infectious disease specialist, also with the Liver Clinic, and I'm a community pharmacist, primarily providing outreach services to a shelter health services team. We're all in the city of Calgary, which is in the Canadian Prairies and is on Treaty 7 traditional territory. So a bit about CUP's Liver Clinic. CUPS is a multidisciplinary clinic in downtown Calgary that primarily provides care to individuals experiencing homelessness and poverty. They also have a liver clinic within CUPS that provides Hep C care as well as STBBI testing and treatment. Just because of COVID, they've had to reconsider how they provide that care, as well as linkage to treatment and follow-up. For a little bit of context, the Calgary Drop-In Center is a very large shelter in downtown Calgary that before COVID was providing services for upwards of 500 clients a night. It's also unique in that it has a 24/7 on-site health services team consisting of nurses, pharmacists, physicians, and provides a number of services such as wound care, medication support, and has medical beds that since the start of COVID have provided a medically supported area for clients required to self-isolate. It makes a lot of sense to provide targeted Hep C treatment services to people living in shelters, since the majority of our clients have a number of risk factors for contracting it. Unfortunately, our clients also experience a number of challenges in accessing healthcare services through traditional access points like community or outpatient clinics. Even just booking and attending appointments can be a challenge, with many clients feeling stigmatized in traditional clinical environments and often require support and advocacy for their needs to be met. Meeting the unique needs of clients living in shelter was a key priority for our treatment pathway. Just from experience providing health services to shelter clients, we've learned that the following pieces listed on the left side of the slide here are quite important to providing care that meets their needs. Some important pieces of that were making sure that access and knowledge to Hep C care is decentralized and low barrier, essentially providing services where the clients are at. An important piece of this is training and capacity building with frontline staff to provide screening and point of care tests, for example. Another essential piece with this was pharmacy integration and support for providing medication safely and effectively within the shelter, which can be a bit of a logistical challenge in environments that are not healthcare facilities by design. Since safe storage is an issue, and because not all clients are independent with their medications, building capacity with shelter staff to provide that support was an important piece of this. So this is our treatment pathway, where you can see all activities occurring within the shelter in the orange box on the left, and all liver clinic activities occurring remotely in the blue box on the right. Shelter nurses provide screening, point of care tests, as well as pre and post test counseling on an ongoing basis for clients as they access other shelter services, and are able to initiate confirmatory blood work for any clients testing positive. Clients are then referred to the pharmacist for treatment workup and case review with the liver clinic, which includes specialist referral for clients at risk of cirrhosis or co-infection, for example. We're then able to organize treatment start and medication administration support within the shelter, which can be paired with opioid agonist treatment with methadone or Suboxone for clients experiencing concurrent addictions. Clients are monitored daily by health services and shelter care workers, and with Hep C care occurring alongside regular day-to-day health services activities, which includes connection to primary care and harm reduction supports, which are also available in the shelter. So we hope our model can be expanded to other shelter environments and first contact points for vulnerable populations as a way to streamline Hep C care into areas where traditional care models are missing the hardest to reach clients. Some key activities in achieving this were collaboration between the liver clinic pharmacy and the shelter health services team, creation of online modules for training and capacity building with frontline staff, providing counseling, screening, testing, and blood work, and then framework for medication administration and monitoring in shelter. So thanks so much for tuning in. Please feel free to reach out if you have any questions or want any clarification on anything. Thank you.